What is esophageal motility in GERD? Imagine your esophagus as a busy conveyor belt moving food from your mouth to your stomach. When everything works smoothly, the muscles contract just right to push food down. This process is called esophageal motility. It involves coordinated muscle contractions, known as peristalsis, which are like waves that propel food along the esophagus. At the bottom of the esophagus, there is a muscle ring called the lower esophageal sphincter. It stays closed most of the time to keep stomach contents from coming back up. When you swallow, this muscle relaxes briefly to let food pass into your stomach. In people with acid reflux and gastroesophageal reflux disease, or GERD, esophageal motility becomes especially important. GERD happens when stomach acid flows back into the esophagus often enough to cause discomfort and damage. Usually, this occurs because the lower esophageal sphincter relaxes when it shouldn't or is weak. But how well the esophagus moves and clears acid also plays a big role. If the esophagus moves normally, it can clear away the acid quickly, reducing irritation. However, in some GERD cases, esophageal motility is impaired. This means the muscles don't contract strongly or in a coordinated way. When contractions are weak or uncoordinated, the esophagus struggles to clear refluxed acid. This causes acid to stay in the esophagus longer, increasing the risk of inflammation and damage. One common problem is called ineffective esophageal motility. It is when the muscle contractions in the lower part of the esophagus are weak or happen randomly. This makes it harder for the esophagus to push acid back down and clear out. The link between GERD and esophageal motility is complex. Frequent acid reflux can damage the esophagus and weaken its muscles over time. When the muscles weaken, reflux can become worse. On the other hand, poor motility makes it easier for acid to stay in the esophagus longer, worsening symptoms. This creates a cycle where reflux causes injury, which then worsens motility, leading to even more reflux. Understanding how esophageal motility works helps explain why some people have more severe GERD symptoms. Those with impaired motility often experience frequent heartburn and slower healing of esophageal damage. They are also more likely to develop complications like esophagitis or Barrett's esophagus. Doctors can test esophageal motility with a procedure called manometry. This test measures the strength and coordination of muscle contractions in the esophagus. Knowing about esophageal motility helps doctors decide on the best treatment options. If you have ongoing GERD symptoms despite medication, your doctor might recommend a manometry test. This helps identify if motility issues are contributing to your reflux. Based on the results, your doctor can suggest treatments that improve esophageal movement or reduce acid reflux. Recognizing the role of esophageal motility in GERD helps tailor treatments to your specific needs. It's not just about reducing acid but also about improving how your esophagus handles reflux.